Thank you for coming. We're here to provide an update to the community about the City of San Antonio and Bexar County's efforts to deal with the current surge of COVID-19. We'll discuss the current demand for testing, what we're seeing at our local hospitals, and what the city and the county are doing to stop the spread of the virus. We know it's been a rough past 2 years as we combat COVID-19, and we understand that many people are experiencing pandemic fatigue that affects you emotionally, mentally, and physically. We're all human, and that's okay to feel overwhelmed and vulnerable, especially during these trying times. You're not alone. I'd ask you to think about the teachers, the doctors, the healthcare workers, the nurses, the firefighters, the first responders who have been dealing with this alongside all of our community. Just when we thought things were taking a turn for the better, we do find ourselves, however, amid another COVID surge, all due to the Omicron variant. Our risk level remains severe for the third consecutive week, and just as we expected, our positivity rate once again increased this week to 38.3%. We've seen positivity rates in major metros of the state of Texas over 50% in some parts of Texas at this point. Should the current trajectory continue, we'll find our risk level in the critical category. Although it's hard to tell if we've yet reached our peak, or when we will reach our peak, we continue to monitor the data and situation constantly. Of course, we all hope for a decline very soon. We need to work together to get through this winter surge, and there are actions that we can take. For everyone who has taken the time to get vaccinated, that's the first and most important step, along with getting boosted. If you are eligible for a booster and you haven't been boosted yet, go get one. You are not up to date if you haven't. Thank you for doing your part to protect yourself and your loved ones, your family, our community, especially those who are not able to get vaccinated, such as children under 5 years old. Remember that COVID-19 vaccinations are available to everyone ages 5 and older, and we continue to ensure that these free vaccines, again, they are free, and they are available to all residents in neighborhoods all throughout the city. Vaccinations have been a key strategy in keeping you protected from COVID-19, and they help us slow the spread of coronavirus. Again, we urge everyone who is yet to get vaccinated to please make an extra effort to do so. Over the past several weeks, we've deployed more resources to help contain COVID-19. We've requested more, and we've received more resources, such as additional nurses and testing sites from our state and federal partners. I just recently, in fact yesterday, was meeting with the federal administrator about the reimbursements and the resources that have been headed our way and that will continue to from our federal government. Because of the rampant spread of the Omicron variant, people are urgently seeking to get tested. On Tuesday, the City of San Antonio, with the support of the Texas Division of Emergency Management, opened a federal COVID-19 drive-through testing site in Lot C of this building, the Alamo Dome, as another option to get testing for our community. We know that there are still long lines because there are a lot of folks seeking to get tested, and the wait times are exceeding many of our patients' levels at the test site. So we're doing all that we can to help alleviate those challenges, and please know that these are experienced challenges everywhere in our community and across the country, and are largely due to laboratory slowdowns because of the volume of testing that's occurring all throughout our nation. We encourage you to register today for an appointment at a federal drive-through site. If you're looking to get tested, you can go to doineedtogetacovidtest.com. As simple as that. doineedacovidtest.com. Let me get that right. doineedacovidtest.com. Or you can call 1-800-635-8611. Hours are 7 a.m. to 5 p.m. Monday through Sunday, and they're free. The City of San Antonio also recently opened 6 mass testing sites in partnership with the nonprofit organization Community Labs, and we're offering an additional 20 testing sites through our partner Curative. For information on any of these testing sites, please visit covid19.sanantonio.gov and click on testing, or you can call 311 and hit option 8. Through these combined COVID-19 testing sites, the City of San Antonio and Bexar County now has the capacity to test nearly 12,000 people per day. So again, it's going to take teamwork for us to get through this latest surge. Please continue to do your part. Mask up, get vaccinated, get tested, and if you have symptoms of COVID-19, which mimic many other symptoms you might have during a respiratory season like we're in, please Help us contain the virus by staying home if you are sick, and get tested. Thank you very much, and let me introduce Bexar County Judge Nelson Wolff.
As the mayor stated, we've got a number of testing sites throughout the community. The one that we have over at the Wonderland Mall, and then with Cone Corazon, they're getting a lot of people tested. We're so successful at it that there has been somewhat of a backlog in community labs in terms of getting the results out timely. So they're working hard on that. It's not an easy process. The mayor and I took a tour of community labs, and it's a very comprehensive lab. When you're taking a PCR test, you can be sure the results are going to be right, but there has been some delay in it. We're glad the federal government stepped up with a testing site, but I think we were quite a bit ahead of them and have done a good job of providing a number of testing sites. It's never too late to get the vaccine. Just since January the 3rd, we've given another 8,473 vaccinations at the Wonderland Mall, and plus we've given another 2,156 to children. So don't forget that whether you had COVID in the past or not, if you come and get a test, get a shot, you're going to even be probably more protected than anybody would be protected. So take advantage of the vaccinations, take advantage of the test, be careful in what you do. You never know today where you are and who's got COVID around you, and that you don't want to pick it up. I think our hospitals are doing a great job in handling the patient flow we have. We are getting in people. I was just talking to George Hernandez, CEO of UHS, just a few hours ago. We're getting in patients that are getting sick with something else. Could be a number of different things. But then when they come in, they're also tested and have COVID. So we still have quite a few people in the hospital, and the ones that you obviously the concern the most about are the ones that end up in ICU, and I think we've got a little over 260 people in intensive care units now. So be careful. There's hope that we can work our way through this by the end of the month in January. A lot of models are predicting that, but we don't know that for sure. So just be careful. Do all the proper safety protocols, get your vaccination, get your test. Thank you. Claude Jacobs, head of Metro Health, is going to come speak next.
Thank you, Judge. Good afternoon. Before I share with you the latest data and statistics of the pandemic, Metro Health is again reminding the community that COVID-19 vaccines work to help prevent infection as well as serious illness or hospitalization. It's also important to note that for individuals who are fully vaccinated but have breakthrough infections, they are far more likely to have mild or no symptoms at all. We mention this because people have asked, well, why should they get vaccinated when they hear that people who are fully vaccinated are still getting COVID-19? Breakthrough infections are not uncommon, and you are far better off being vaccinated than not. So here's a quick update regarding what we're seeing here in San Antonio and Bexar County. So total cases of COVID-19 reported to date is 437,687 reported cases to our department. A total number of new cases reported yesterday, 5,841. Our case rate per 100,000 is now 262.8 compared to where we were a week ago, where it was 181.8. Our 7-day moving average is now 5,970. And regarding our vaccination rate, again, the best way for us to be protected as a community, we're now showing that 88.5% of individuals, eligible individuals 5 and older, have received at least 1 dose, and over 72% of individuals 5 and older are fully vaccinated. Keep in mind that 447,436 individuals have received a booster or 3rd dose. So while Metro Health encourages people to get tested if they are experiencing symptoms of COVID-19, we are aware that individuals are having to wait longer than 24 or 48 hours to receive their test results. Because of the highly transmissible Omicron variant, we are seeing an unusually high volume of individuals seeking testing every day, and you've heard that already.